Hey, what's going on, guys? Welcome to my channel, Hairliciously. If you guys are new, please make sure to hit that subscribe button to stay updated on hair loss and hair transplant topics. Visit my website at hairliciously.com to purchase your microneedling devices, which are scientifically proven to stimulate hair growth, my low-level laser therapy cap, hair growth vitamins, DHT blocking shampoo and serum, and a few other products for those who are suffering from hair loss. So in today's video topic, I actually wanted to discuss about a study that shows exactly what you can do at home to determine if hair loss that you're experiencing is indeed androgenic alopecia or not. Now, to give you guys some context and some background information, the average non-balding person typically has about 100,000 hairs on their scalp. This can, obviously differ based on ethnicity, things like genetics, and even things like hair color. But in general, we normally have about 100,000 hairs to start off with. A person who is experiencing hair loss won't see a noticeable difference until they lose about 50% of their native hair. And this is the very reason why when you go to a hair transplant clinic, they try to achieve a density of about 40 to 50% per centimeter squared, because it creates an illusion of a full head of hair. And going anything over 40 to 50% in density would typically be a waste, because 50% is already adequate to give you that full appearance of hair. Now, when you think about it, 40 to 50% density in order to start noticing hair loss is a pretty substantial loss of hair follicles. So the best thing that you guys want to do for your hair is to obviously be proactive on the first signs of menstruation and hair loss. The most common form of hair loss in men is none other than androgenic alopecia, which is dependent on androgens such as testosterone and DHT, as well as their sensitivity to these androgens, and even fluctuating ratios of hormones that can trigger hair loss. We also have other types of hair loss besides androgenic alopecia, such as telogen effluvium, which is a common cause of temporary hair loss and shedding, and it can be attributed to things like trauma, illness, having a stressful event, and even extreme weight loss and dieting. The good thing is that we actually have a study we can reference to that can indicate whether hair loss is caused from androgenic alopecia or not, or if it's just from temporary shedding, because oftentimes the two can be quite similar and you might mistake one for the other. We do, however, see a minority of people who suffer from hair loss that is obviously not due to androgenic alopecia, such as scalp conditions. But generally speaking, if you start noticing the first signs of hair loss, there is going to be a good possibility that it is due to your genetics. So the study is titled Distinguishing Androgenic Alopecia from Chronic Telogen Effluvium When Associated in the Same Patient. This is a simple, non-invasive test that anybody can try at the comfort of their home and determine exactly what type of hair loss that they're experiencing. So basically, it's going to come down to the number of hairs that you're losing per day in the sink or in the shower, and the length of these hairs that are lost. The study consisted of 100 consecutive patients with hair loss who were clinically diagnosed as having chronic telogen effluvium, androgenic alopecia, a combination of the two, or remitting chronic telogen effluvium. Patients washed their hair in the sink in a standardized way. All of the shed hairs were counted and divided blindly into 5 centimeters or longer, intermediate length, which was between 3 and 5 centimeters, or 3 centimeters and shorter. So, basically this wouldn't work for anybody who has shorter hair than that. And the study did indicate that the best concordance between clinical and numerical diagnosis was obtained by setting the cutoff shedding value at 100 hairs or more. So if you had more than 10% hair loss that were 3 centimeters or shorter, and you shed less than 100 in total, you would be diagnosed as having androgenic alopecia. If fewer than 10% of the hairs that you shed were 3 centimeters or shorter, and you shed at least 100 hairs, you would be diagnosed with chronic telogen effluvium. And if more than 10% of the hairs you shed were 3 centimeters or shorter, and you shed at least 100 hairs, you would be diagnosed with both androgenic alopecia and chronic telogen effluvium. This obviously, would be the worst to have, because you would see, you definitely see a significant increase in hair shedding. And this is commonly seen in those with moderate to aggressive hair loss who, undergo a lot of stress, which can aggravate further hair loss at a much exponential rate. And lastly, if you shed less than 10% hairs that were 3 centimeters or shorter, and you shed fewer than 100 hairs in total, you would be diagnosed as having chronic telogen effluvium in remission. This is obviously the best case scenario, since it indicates that you actually do not currently suffer from androgenic alopecia. Okay, so I'm just gonna go over some examples with you. So let's say I took a shower, counted about 75 hairs that were lost, and 10 of them were 3 centimeters or shorter. 10 hairs that were 3 centimeters or shorter out of a total of 75 is more than 10% of the total hairs that were shed. So this would mean that I would be positive for androgenic alopecia. If I showered and lost 150 hairs, but less than 15 of the hair follicles were 3 centimeters or shorter, it likely means that I have chronic telogen effluvium, since the total hair loss that were 3 centimeters or shorter would be less than 10% of the total. And if I showered, lost 150 hairs, and lost more than 15 hairs, which were 3 centimeters or shorter, I would be diagnosed with genetic hair loss and telogen effluvium. And lastly, if I lost 80 hairs and only 5 hairs were 3 centimeters or shorter, this would be considered no hair loss because it would be less than 10% and it would be less than 100 hairs that were lost. So I think that this is a great diagnostic tool to try at home, especially if you guys are losing hair and aren't exactly sure what type of hair loss you think you're experiencing. And I'm not saying that this is 100% accurate because it's not, but it does give a good baseline and I think a good reference to use. And I've actually covered this in an older video that I did right after I got my first hair transplant and started taking finasteride. But what you guys want to do is, especially if you guys want to keep track of your current hair loss situation and even have a good baseline, is to use a shower drain cover to catch all the hair that is shed. Sometimes the drain holes are a little bit bigger and the hairs can actually pass through. So I recommend placing some type of coffee filter or some type of net over it to make sure that you guys are actually capturing all of the hairs that are shed. You can apply this method I just talked about to see if you guys are at risk of genetic hair loss. And this can also be beneficial when you have, or when you want to have a good baseline in the number of hairs you typically lose before you implement a hair loss treatment like finasteride or minoxidil or whatever. That way, after a few months of said treatment, you can see how many hairs that you shed before treatment at baseline and then after, and see if the treatment is actually helping in reducing shedding. If it is, you can actually stack on other treatments that target hair loss through different mechanisms of action and see if you would actually respond favorably. Now, ultimately, the best diagnostic tool for hair loss is obvious to go to a dermatologist and getting your scalp examined. When most doctors see your scalp and see the afflicted areas, with hair loss, they're usually going to know right away what type of hair loss that you're suffering from. Usually, based on the pattern of hair loss, especially like Norwood chart, or if you have, thinning of the crown, those are all indicative of, genetic hair loss. And there's a good chance that if you are losing hair, it's due to your genetics. A lot of these clinics actually have these, digital hair analysis systems. They use microscopic examination to look for signs of miniaturization. So if you are losing hair, I would highly recommend visiting a dermatologist or even a good hair transplant clinic to, get a proper diagnosis. The best thing you can do for treating hair loss is to, number one, be proactive and prevent it before you start noticing hair loss, because by the time that you start noticing hair loss, you're likely to have lost a good amount of density. And, if you have, especially if you have, hair loss running in the family, or if you suddenly notice shedding, don't wait to get it checked out, because the sooner that you guys act, the more likely you are able to minimize and stabilize further hair loss. Treat the root cause of hair loss by tackling the androgens through 5-alpha reductase inhibitors or anti-androgens. Get on minoxidil, microneedling, laser therapy, whatever that you guys have to do. So that's all I have for today, guys. Hope you guys found this study to be interesting and helpful. If you have actually tried out this method I just talked about, let me know what your thoughts are. Thanks for watching this video, and I'll talk to you guys in the next video. Take care.